really early in the morning. But let's try this anyway. So I've got a client of mine who has one of her cervical discs is actually bulging over to the side, so it causes some discomfort and radiating pain down in her arm and hand. And it also causes some of the sensory challenges, so she feels like her arm and hand is different. Now, one of the ways that we've been working to rectify that and to change that, to make it better for her, is to slowly shave off some of that tension that's involved around her neck, shoulders, arm, shoulder blade, elbow, wrist, and hand. So one of the things that we've started off with is really easy turning your head side to side. And this can be anywhere from 3 to 5 repetitions in each direction. And then it's tilting your head, lengthening the back of your neck, and then shortening the back of your neck, looking up and then looking down. And then from here, it's sliding your head forward and sliding your head backward. So it's like you've got your head on a table, sliding forward and sliding backward. And then from here, we're tilting your head over towards the side to bring the corner of your jaw up towards the ceiling. Not bending your head towards your shoulder, not bending your head towards your shoulder. Taking the corner of your jaw up to lengthen the side of your neck. And for lack of a better metaphor, it's like getting caught in a noose and whack, strung up towards the ceiling. And then from here, we've got your arms straight out to your sides. So the idea is you're going to rotate your shoulders, one up, forward and down, and the other back, down, and open. And then reverse that. So lift, twist, and turn. So you're bringing your shoulder up, down, and forward to soften your chest in and allow your shoulder to collapse down as your other shoulder opens up and turns. So nice and easy side to side. And then to bring in your shoulder blades and your spine and your chest. So it's going to be pushing your sternum up towards the ceiling. So you're trying to push that sternum up to expand your chest and then round your back backwards. Take your arms forward, drop your head down, and then push your chest up forward, round your back backwards, push forward, and then round your back. And then from here, we're moving on down to your elbow. So with your hand straight out in front of you, you can make a fist with your thumb out, bring your thumb in towards your chest, and then over the top. And as your hand comes over the top, the idea is that you want to try and turn and crank your hand downward so you can open up your elbow joint in the front. And then again, turn over the top, crank that hand down, and then turn over the top, crank that hand down. Now you can actually reverse this pattern as well. So you turn your thumb out toward the outside and then come around, and you can turn your arm in, thumb out towards the outside, and then turn your arm in. So you got both directions that you can actually move with the elbow. And then with the wrist and hand, the idea is you're going to try and take your wrist and have it out in front of you. It's easiest usually to have it kind of bent at your side, but you want to see if you can move your wrist up and down and not move your hand up and down, because this is moving your hand on top of your wrist, but you're actually trying to move your wrist on top of your hand. So nice, easy up and down. And the other pattern that we're using, just to kind of take it all the way down to the fingertips, is to start with your hands and your fingers spread as wide as apart as you can get them, and begin to make circles with your fingers. And then when you do 3 to 5 circles with that finger, move on to the next, and then to the next, all the way down to your pinky, And then when you get to your pinky or your little finger, go back the other direction. So start to make circles in the opposite way. And this is a way to open up and free tension in your hand, your wrist, your fingers, the small muscles in between.